Good afternoon, ladies and gentlemen. I'm Dr. Brian Lin from Taiwan Universal Eye Center. It's my pleasure to share with you my topic about Sub Bowman's flat 85 micron LASIK, a pilot study interim result, no financial interest to disclosure. First of all, I would like to talk about the advantage of thin flap briefly. As we know, sufficiently still stroma-based RSB thickness is important to reduce the likelihood of corneal ectasia. Thin flap can help maximize the RSB thickness and preserve the biochemical stability of the cornea, and leaving sufficient stroma tissue to allow for safer excimer laser ablation. This is especially beneficial for patients with thin cornea and high myopia. Let's see this high myopic patient for example. If we set 130 micron flap thickness and 6.5 millimeter optic zone, just as most of the surgeons do, the ratio, the RSB thickness is only 254 microns. If we want to reserve more RSB thickness, most of the surgeons decrease the OZ to 6 millimeter or less. However, this patient's mesopic pupil size is only 6.2 millimeter, so I don't think this is a good choice to decrease the OZ. The same patient, if we set 110 micron flap thickness, we can preserve more RSB thickness under 6.5 millimeter. Furthermore, if we perform 85 micron flap thickness under OCT guidance, the RSB thickness will approach to 300 microns. This is real beneficial for these high myopic patients. Okay, let's back to our study. The purpose is report on visual results, patient-reported outcomes, flap thickness, precision in eyes undergoing 85 micron elliptical thin flap LASIK with a temporal hinge and 120 degrees side cut angle. We perform a prospective pilot study to evaluate pre-op and post-op tested included BCVA, UCVA. Patients were evaluated before surgery and 1 day, 1 week, 2 weeks, and 1 month after surgery. In all cases, we use customized wavelength EX500 excimer laser followed thin flap creation by OCT guided for visualization. A pen questionnaire was conducted at 1 day, 2 day, and 1 week postoperatively. The target flap thickness varied from 85 micron, 90 micron, and 100 micron. The result: we use Hedberg optical coherent tomography was used to measure the post-operative flap thickness. We found achieved flap thickness were measured to be very close to intended flap thickness in all cases. All patients were highly satisfied with the procedure. No adverse events reported. No intra or post-operative complications reported. From these tables, we can see most of the patients had significant improvement in their vision to 20/20 within the day 1 post-op and get better and stable eyesight in the post-operative 1 week, 2 week, and 1 month. We use Hedberg anterior segment OCT in the postoperative visualization of flap thickness. From these tables, we can see target flap thickness in all 3 groups remains stable. The mean target flap thickness in 85 micron group was 84.6 microns. Our conclusion: 85 micron thin flap LASIK created by femto LDVCA is considered to offer advantage of both surface and flap techniques. This can reserve more than 300 micron of the corneal stroma bed, and especially beneficial in patients with synconia and high myopia. Second, the intraoperative OCT guidance of the treatment can be help surgeon to visualize the epithelium and plan targeted Sub Bowman flap of 80 to 90 micron effectively. So we can perform thin flap in patients with corneal scar and previous LASIK we need for enhancement. From this video, we can see no trouble to lift, separate, back down, and probably fit in performing 85 micron thin flap. Thank you for your attention.